I think my greatest experience really did come here in the refugee clinic. So back when I was just a volunteer, I remember doing some interviews, some medical interviews with the refugees, and it's really interesting to hear their stories of what has gone on in their home country and how they've brought here. So a lot of my experiences have been not only providing the medical care to them here, but also listening to them, hearing them out, and kind of finding other ways that we can provide social support to them as they adjust to life in the United States. I remember one patient was diagnosed with a very specific disease that we had been learning about in class, and when you see the words on the page, it doesn't mean much, but then when I actually got to see a patient and talk to the attending about the things that we would do to go through to treat them, it really made me feel that what I was learning was worthwhile.
A lot of our patients face trauma secondary to war and migration, and a lot of them also have significant medical problems that they unfortunately haven't been able to get the medical attention for back in their home country. And so now that they're here, they're still facing a lot of issues with being able to access medical care. For many of them, like Refugee Clinic is the only place that they really have access to care. A lot of them are separated from their families, and all of that can really create a burden on them, and it really does affect their physical and mental health. We really just provide basic medical services. We get their history and physical checked, and then we have some medications that we're able to provide.
So, of course, we have our main medical clinic. Here we kind of work as an urgent care. We see them for any medical complaints they might have. Every other week we have our wellness nights, and so that is a unique opportunity for our patients to get psychiatric help.
We have med student leaders, psych, dental, and physical therapy and nursing. And so being able to interact with all the other schools and using everyone's minds together to figure out how to run the clinic in a way that's most effective for the volunteers and the refugees.
Medical missions is a passion of mine. When I heard about this clinic, I thought this would be the perfect fit. A lot of them have depression and PTSD related to whether it's something they have from their home country or just the change in their lives of moving here and bringing their family here, not knowing what to do. So we actually deal a lot with mental health. We also have several that are just experiencing the stress of moving to a remote place.
So Refugee Clinic is very unique amongst the clinics. We are very interprofessional in nature. So really it's kind of, for such a small clinic, we do a little bit of everything. And then being able to interact with those people here at Refugee Clinic, both the refugees, the volunteers, the attendings, has been truly really rewarding and kind of reminds me why I went into medicine in the first place.